Positional clubfoot in newborns, also known as positional talipes, is a condition where the baby's foot appears to be turned inwards. This can be mistaken for a true clubfoot or a CTEV, but there are key differences between the two. The first one, foot flexibility. In positional clubfoot, the foot is flexible and can be easily moved into a normal position by hand. This flexibility indicates that the structure of the foot is normal, but they have been positioned incorrectly due to baby's position in the womb or the uterus. In true clubfoot, the foot is usually stiff and rigid. Attempts to move the foot into a normal position are met with resistance. Second, the heel position. If you carefully see, in a positional clubfoot, the heel is typically in normal position. In true clubfoot, the heel is often elevated, that means upwards, foot pointing downwards, and the heel is turned inwards, contributing to the more severe deformity. Third difference, correctability. Positional clubfoot is correctable with gentle stretching exercises or sometimes just with normal handling. The condition often resolves on its own within a few months as the baby grows and starts to move more. The clubfoot, which is true/idiopathic, does not correct on its own and requires medical intervention, which may require plasters, bracing, and very rarely surgery if it is not treated on time. Fourth difference, foot appearance. In positional clubfoot, the foot may appear turned in, but the structures of the foot, including the bones and muscles and ligaments, are normal. In true clubfoot, the bones, muscles, and tendons are abnormally formed and position. Now we should know some important details like what is the natural history of a positional clubfoot. We do get a lot of patients with positional clubfoot referred by pediatricians where the parents are panicking, are worried that the child may not have a normal feet and may not have normal function later on in life. But positional clubfoot is a benign condition. Generally does not cause long-term problems. The condition is usually diagnosed at birth during a physical examination. In most cases, the foot will gradually return to a normal position without any intervention as the baby begins to kick and move their legs more frequently. Parents can assist this process by gently stretching the baby's foot into a more natural position during diaper change and other routine care activities like massages. Specific videos of the kind of stretching are already present in my other YouTube videos on clubfoot where I have explained how to manipulate a twisted foot in a newborn baby. The pediatricians may recommend some simple at-home exercises to help, but in most cases, no formal treatment or follow-up is required. Checkups at 2 or 3 months may be required to ensure that the foot is progressing as expected. By the time the child begins to walk, the foot typically appears normal and the child will have a normal gait. Parents should not worry if their newborn has positional clubfoot, as it is a common and a self-limiting condition usually seen in first-time mothers. Unlike true clubfoot, which requires medical intervention and plasters, positional clubfoot corrects itself naturally. It's important to monitor the baby's development and follow any guideline from pediatric orthopedic surgeons to ensure proper foot growth and alignment. Now, as pediatric orthopedic surgeon, I can recommend that a newborn with positional clubfoot is a benign condition and the parents can follow very simple and gentle exercises at home to help correct the foot position. Some of the examples are as follows. Gentle stretching of the foot as demonstrated in our clubfoot videos can be done every time the child is massaged and taken care of or the diaper is changed. The stretching can be done 10 to 15 times a day. Foot massages also help. When the baby is lying on their back, gently move their legs in a bicycle pedaling position. This promotes overall leg flexibility and helps natural foot movement. It should be repeated several times a day, especially during playtime or diaper change. These are called as bicycle kicks. Now, the child may also be encouraged to have more of tummy time. Place the baby on their stomach while they're awake and supervise. This encourages the baby to kick and move their legs, helping the foot to turn in its natural position. This as well can be repeated for many minutes several times a day. These exercises should be gentle, should not cause the baby any discomfort. If the baby feels or is in pain, the pediatric orthopedic surgeon should be consulted. If the parents or the family at any time have concerns or they feel that the foot does not seem to be improving, they should immediately consult their pediatrician and a pediatric orthopedic surgeon to rule out other similar disorders which may require treatment and medical intervention. I hope this information on positional clubfoot is useful to allay the fears of many such parents who may be born with a positional clubfoot. Thank you.